All right, good afternoon, everyone. You are in the session Mental Health First Aid and the Public Library, and we're excited to have you join us. So my name is Claire Leverett, and I'm the Associate Director at NC Live. And as the moderator for this session, I just want to share a few things before we begin. So at NC Live events, we value the presence and active participation of all attendees. And by joining us, you agree to uphold the principles of our code of conduct, which can be found on our website. And I will also add a link right now in the chat. And in the interest of time, we'll save question and answer for the end of the presentation. But if you have a question during the presentation, please put it in the chat box. And I will be monitoring the chat throughout the session in case anyone has a question or needs assistance. And please make sure that you also stay muted during the presentation. We're recording this session, and the session and the slides will be available after today's sessions. So now I am pleased to introduce Gina Petrie, and she is at Charlotte Mecklenburg Public Library. And Gina is the Adult Services Librarian with Charlotte Mecklenburg Library. She is a graduate of Davidson College. She received her MA in English and her MS/LS from the University of North Carolina at Chapel Hill. She received a grant from the Library Foundation to provide mental health first aid training. And now I will hand it over to Gina.
Thank you, Claire. Thank you so much, everyone, for being here. I am so excited to be able to talk with you this afternoon about mental health and mental health first aid in the library. Just a quick outline that I don't have on a slide, so I'll just go over verbally what my plans are. I'll describe for you my library location, talk about the state of mental health in the United States, describe the mental health first aid program, and describe how we implemented that at our library, the outcomes and the challenges. And then, of course, I'm happy to answer questions at the end. Let me share my screen with you real quick. There we are. Oh. I'm sharing, which is the good news. I am not able to move my slides forward, which is the less good news. Let me see. Oh, there we are. There we are. So I am at the University City Library. It's a regional library. It's one of 21 branches in the Charlotte Mecklenburg Library system. We have 35 employees at our location, both full-time and part-time. This is the front of the library, and there's a big wing out to the left as you're facing the front. So it's bigger than it looks. It's about 25,000 square feet. It's been that same size since a remodel in 1999. So we've been in this same place with this same footprint for 25 years. And I'm happy to tell you that in the spring of 2025, so less than a year from now, we'll be moving into this new location that's under construction. It will be around 35,000 square feet. It will be 2 stories. It will be much closer to restaurants and shops, close to the light rail, a much more vibrant area with much better parking, easier to find. And we're very, very excited about making plans for this new building. May is a perfect time to talk about mental health. For 75 years, May has been recognized as Mental Health Awareness Month. in the United States. The theme for this year is Where to Start: Mental Health in a Changing World. And for the first time, our library marketing department has created this graphic to acknowledge Mental Health Awareness Month for this month. This has been up on our homepage for the month of May. And you might suspect that green is the color of mental health and mental health awareness. So you'll see lots of green as we go through these slides. We all know from our own experience that the pandemic was very challenging, and particularly challenging to everyone's mental health. In 2019, so the year before the pandemic, if you lose track of time the way I do, just before the pandemic, 10.8% of people surveyed reported that they were struggling with depression or anxiety. In the middle of the pandemic in 2022, that number jumped up to almost 34%. And the latest numbers from just last month, just from April, indicate that 21% of people in this country are still dealing with difficulties regarding depression and anxiety. Some more statistics while we're talking numbers. On average, 132 people die by suicide in this country every day. So that you don't have to do the math, I did it, and that is 48,000 people, more than 48,000 people per year. In 2022, there were almost 108,000 deaths from drug overdoses, and nearly 1 in 5 people in this country live with a mental illness. You know, the numbers are very striking, but I know that none of us who work with the public needed the numbers to know that that people are struggling. We see it every day in our patrons, with our coworkers, with our friends and family, in ourselves. Many of us are struggling as well. And libraries already do many things. We offer a variety of programs to address concerns. We do meditation, we do mindfulness, we offer yoga and self-care. We have ramped up the purchasing of materials that will address the anxiety and depression that we mentioned, OCD and ADHD and eating disorders, and just everything. We are working hard to fill the gap and to help our patrons and to help our colleagues. The question that I have and that I want to put forth to you is, can we do more? About 7 years ago, I attended a mental health first aid training just for myself. It wasn't a library initiative. It was at a local college. And I became certified in what they call mental health first aid. And a very quick definition is that mental health first aid teaches you how to identify, understand, and respond to signs of mental health and substance use challenges among adults. I have next a short video. It's really just 4 minutes that the Mental Health First Aid organization created. And I want to show that to you just to help you visualize the importance of what I'll be talking about going forward.
I'm Danny. I've lived with depression and anxiety for about 12 years, and today I'm going to be opening up about those mental health challenges with some complete strangers in the hopes that we can start normalizing conversations about mental health. Hi, I'm Danny. Nice to meet you.
I'm Colleen. It's nice to meet you too.
Cecilio, nice to meet you.
How are you?
Doing well, thank you.
I'm doing really good.
Yeah.
Doing good. Yourself?
I'm actually not doing so well today.
Okay, that's honest.
Oh, it's all right.
Okay. So
Okay. Okay. What's going on?
can you tell me a little bit more about it? Do you feel comfortable talking about it, or?
Yeah, I can talk about it. So I've been living with depression for a long time, and this week has been particularly hard for me. So a lot of people simply just don't know what to say and what to do when somebody opens up to them about a mental health or addiction challenge. And that's really where mental health first aid can be valuable. It teaches people a concrete action plan for starting a conversation and getting somebody the support that they need, whether that's treatment or just a non-judgmental listening ear. So was it a little unexpected when I responded that I wasn't doing well, us being complete strangers until this moment?
I'll be honest, it caught me off guard. You just expect the automatic response of, how are you doing? I'm good.
When you first meet someone, here there's like a huge distance.
I always feel like, how can I help someone else? So, and I know it's hard because you just want to be like, oh, sorry, okay, let me run,
And I don't think people do it because they're inconsiderate. I think it's because they honestly just don't know what to say.
Have you talked to anyone about this?
Sometimes I just don't want to burden.
I know it feels like that, but most of the time people want to help.
Yeah.
Like everyone kind of wants to be useful to other people, so they want to help you. So
Yeah.
don't feel like you're burdening them.
That was really nice.
That's so sweet. I like totally wanted to give you a hug, and then I was like, that might be weird, but okay.
No, that was like exactly like what you should have said.
Myself, I was thinking like, okay, this person is in need of help. Try your best. Listen to them. Sometimes that's the best thing you can do is just listen.
If you had cancer, you wouldn't just try to you wouldn't will yourself to get better with that. And so I hope that people just start talking about it more.
Wouldn't it be refreshing if we could take off the mask?
Yes, absolutely. Be real people.
So how did you learn how to respond that way?
My father committed suicide when I was young, and it was like a really pivotal change. And I think I spent most of my life trying to avoid that and avoid talking about that and like the shame and the guilt. So I really made this decision to like learn how to interact with people and be empathetic and show people that someone does care about them even if I don't know you. I think people should just ask more questions, because it's like once you get to know the person and understand that it could literally be any of us, like any of us could have this at any point in our lives, how could you make a judgment on it?
Can I give you a hug?
Well, absolutely. I love hugs.
Thank you. I'm Danny. I've lived with depression.
So sorry. We are. So I wanted to bring this to our location at University City. In the video we just saw, the woman said to the woman in the kind of pink and black, whose father had died by suicide, she said, "How did you learn to talk to people?" And she indicated that she learned from experience. And, all of us don't have that experience and don't want that experience. But we might be in situations where we can be listeners and can provide resources for people. I learned from the mental health first aid training that I did, just a 5-step action plan when someone indicates they might need assistance, or if you see someone who appears that they might need your help. Number 1 is approach and assess and assist. Number 2 is to listen non-judgmentally. Number 3, give support and provide information. Number 4, encourage appropriate professional help. And number 5, encourage self-help and other support strategies. So as I said, I wanted to bring it to our location, but I knew it would be expensive. I knew that offering with a fee-based instructor would take up most of the programming budget that we had for the entire year. And I work with 5 other adult services programmers, and I'm sure they did not want me to use up all the money. And then an opportunity appeared in the form of the Flight Fund, offered for the first time in the fall of 2022 by the Library Foundation, so the fundraising arm of Charlotte Mecklenburg Library. They wanted to provide funds throughout the system for people to do programs that they couldn't do with their regular budget allocation. So exactly what I had in mind. You had to fill out a form, write some essays, and provide a budget. So the first thing I did was ask around who could offer the training for us in the Charlotte or the Mecklenburg County area. And I asked different mental health organizations. I asked our local, one of our local hospital systems, and the name that came up over and over and over again was this one, Lynn Henninghausen. Lynn is someone who has trained more than 3,500 people. She is also a national trainer, so she teaches people who want to be first aid instructors. She co-founded Davidson Lifeline in 2012, which is an organization in Davidson where I live that works for mental health and suicide prevention. And so I reached out to Lynn and we met and talked, and she was fully on board. She was very excited about the possibility of working with the library. She presented several different types or formats, I should say, of training that mental health first aid makes available. The first option is an all in-person option. So it's 7.5 hours of in-person training that she would teach. I wanted to do this on a Saturday, and the library is only open for 8 hours on Saturday. And I didn't feel like I could provide lunch for everybody. They certainly couldn't go get lunch in the 30 minutes they might have off. So we looked at option B, which was a blended model, is a blended model. So the people who register do 2 hours of work in advance, some recordings and some questions, some worksheets that they will do from home before they arrive. And then they have around 5 hours of in-person training. And so that worked much better with our schedule. That's the model that we settled on. We started early in the morning and finished just before a late lunch. But first I should show you the budget that we did come up with, and you'll see why I didn't have money for lunch, because the maximum that you could apply for was $2,500. And my budget came in my request came in at $2,286. So let me tell you the breakdown of what I proposed when I sent in my my essay and my request for a flight fund grant. So Lynn's fee as a presenter, and she does this as her business, I should say. It's not a side gig. Her fee is $1,200. Each person who participates is required to have a workbook, and I wanted 30 people. Each workbook is $23.95. And so that total was just over $700. And then my third ask was for t-shirts for my staff, the staff at my location, to wear during May. I wanted them to have shirts that would advertise the program and that would advocate for mental health. I wanted them to have something that people would notice and ask about. And when they were asked, they could say, oh, the library is having a mental health first aid program. Let me show you a flyer, or let me help you register. If they were comfortable doing that. Wasn't required, but it was an option for staff. So I asked them if they would be comfortable wearing such a shirt, and they said that they would. I asked what they would be comfortable walking around, what slogan or logo would they be comfortable with. And I got some feedback on that. And in the lower right corner, it's about half the staff at my location in their mental health is health t-shirts. That's what we decided would be neutral, and it would they would be comfortable wearing it. The model that I had for t-shirts is from the photo on the left. That is a photo of two employees at the Green Bean Coffee House in Altoona, Pennsylvania. I've never been to the Green Bean Coffee House. I've never been to Altoona, Pennsylvania, but a college classmate posted that on social media. And for May of 2021, the staff in that coffee house wore shirts for mental health awareness in memory of a coworker who had died by suicide. And I had always remembered that. And then when it came time to apply for the grant, I pulled up those photos, put them in my application, and made a case for the t-shirts. And I'm happy to say that the grant was fully funded. And so we were able to move forward and plan for a program. It was near the end of May of last year that we did it. While we didn't have lunch, we had some substantial snacks. We started it, as I said, early in the morning, early-ish at 9:30. And we, had muffins, coffee, of course, other snacks, some fruit, and people could grab that, join their friends and future friends at their tables, and then they were free to eat all throughout the morning, grab some water or whatever. Way that I thought it would. And I wanted to tell you the lessons that I learned. And the first one was a really hard one. Fewer people will come than expected. Now, if you do library program, you know that that's typical. You might get a half, you might get, a third of the people who sign up. but I really thought this program would be different. I had 40 people registered. I had 5 people on the waiting list. They received more than one reminder from me. They received information from Lynn, the presenter, about the pre-work. And I also thought that it's not the kind of program someone does just or registers for just on a whim. You know, you might sign up for a craft that would last 30 to 45 minutes, or you might sign up to learn about credit cards and financial literacy, and then maybe not be able to come the day of. But if you have committed to a 5-hour programming opportunity, and you know that you'll get a certificate at the end, and you have pre-work to do ahead of time, I thought that meant that you would be very serious about it and you would show up. But only 12 people came, as I said. I had one person from a local organization or business register for himself and all 9 of his employees. He felt like he told me it would be very important. And then none of them came. And so that was discouraging, because I had also seen this as a model maybe for what we could do as a library system. You know, if it was successful, if we had 30 or 40 people, then maybe other locations could do it and we could grow and expand the opportunity. And regardless, the 12 people who came were really good and enjoyed the program. Some drove from an hour or 2 away because we were the closest place that offered the training. And so we were happy to have them. And on the bright side, I only had to pay for 12 workbooks instead of 30. So there was a savings there. I will say that having Lynn as a trainer was key. She did so much behind the scenes work and gave me all of the information, all of the flyers that I needed, communicated with the people, sent them out the pre-work. And she was just excellent when she was here. The 12 who did come said it was fabulous, and they were very glad that they had been able to attend. I had, in addition to the folks that I mentioned who had a bit of a drive to get here, we had 2 sisters who came because they wanted to be able to support each other and their families. So it was good. And when I wrote number 3 here for my lessons learned, I said mental health first aid is important. Don't give up and don't get discouraged. You can make it happen. And I realized after I wrote that with you all in mind that that was a lesson I needed to fully absorb myself, because I think I let my discouragement at the low attendance, number 1, really derail my efforts in a way that maybe I should not have. I think that now that I've re-examined this and had the opportunity to talk here with you, I think there are opportunities for us to move forward and maybe in a different way here in our Charlotte Mecklenburg Library organization. I realize that we are from libraries of different sizes and different budgets, and you might not have $2,200 or $2,300 extra. You might not have a library foundation who can offer to fund your program. And so I wanted to talk about some ways maybe that it could be done for less money. it is possible to get a trainer that or an instructor that does not charge. I did learn through my early conversations that one of our local hospitals has an outreach or an education arm, and they had someone who does mental health first aid training. In fact, that person knew Lynn Henninghausen and had worked with her because she had his job before she went off and launched her own business. And so he does training for free to organizations in our area. He was one of the ones, though, who told me that he could come, but he wasn't nearly as good as Lynn was, and that if I had money, I could and should bring Lynn on board at least this first time. But it's possible to find someone who doesn't charge. It is also possible to become certified to teach mental health first aid yourself. The training is a 3-day training and it costs $2,000, but it's a one-time fee. There's a minimum of 2 or maybe 3 classes that you have to teach per year to keep your certification to be a trainer. The downside is that the organization does not offer scholarships or grants. They will help you get in touch with someone who will offer grants or scholarships. They will provide you with those names, but they won't provide you with any money. But it's possible. So $2,000, 3 days, and then you would be trained and could teach the staff. You could teach programming throughout your system. It's an option, and it's one I'm considering for myself. The other thing is you might be able to have people pay for their own workbooks. Our library system won't do that. We're required to have everything free and open to the public, so we can't charge anyone who comes to our programs for anything. But your library might have a different policy. And then certainly you don't have to have the t-shirts, although I'm a big fan of the t-shirts. It's not required, and it certainly is optional. So there are ways for it to be less expensive than I indicated it was for us here. I would be remiss in a conversation about mental health if I didn't mention the 988 Suicide and Crisis Lifeline. And so I want everyone to be aware of that for you or your patrons or your family or friends. I want to thank the Charlotte Mecklenburg Library Foundation, my manager here at University City Regional, Deborah Sharp, who encouraged me to apply for the grant and who was very open to the possibility of this programming here at my location, and my colleagues at University City who wore and continue to wear their Mental Health is Health t-shirts. I walked past someone in the Access Services Department today sitting at the checkout desk who is proudly wearing her shirts. And so it's a gift that keeps on giving in a good way. I know you'll get a copy, or you should get a copy of this brief slideshow. And so I have just a page of resources that you might find helpful. Just to point out a couple of them, the top one is from Oriental Trading Company. If you remember back in the photo of the library staff wearing their t-shirts, some of them were holding up posters about mental health, and those posters came from Oriental Trading. The t-shirts came from 4Imprint, and a big shout out to them. The first t-shirts that were ordered were lovely, but then when people washed them, the white letters started flaking off. And so I contacted For Imprint and said, we have a problem. And they immediately rushed out new t-shirts for us that did not have that problem at no extra charge. And so I was grateful to them for that. And then, of course, mental health first aid sites and the sources from the CDC and so forth for my statistics. I am happy to answer any questions that you have. And I also would be interested to know if you have offered something like mental health first aid or similar in your locations, what kind of mental health programming you do wherever you are. So thank you so much for your time and for listening.
Thank you, Gina. That was great. It was really wonderful to learn about that program, and yeah, inspiring to think that we could all do a similar program and get more people trained in that. So yeah, everyone, if you have questions, feel free to put them in the chat, or you can also unmute yourself and ask your question.
Have any of you done, I'll ask you a question. Have any of you done, if not the mental health first aid training, have you addressed mental health concerns in your community in some way? I do see a question. Thank you, Andrea. Was this training offered to staff? That's an excellent question. Staff could attend, but on their own time. So I actually participated as a person who took the course, again, because my certification had expired. And there were 2 other staff members who came on their own time on a Saturday, but it was not paid time. And so it was not offered to staff in that way. At one of our breakout sessions at a staff day retreat, there was a brief introduction to the concept of mental health first aid training, but it was just about a 45-minute brief description of it and not the full-on training. I would love to be able to bring it to staff in its full form. Thank you. Jasmine says there's a mental health series for teens in September. Oops. Excellent. The second year. I should mention, thank you for that. I should mention that there is a separate training for mental health first aid addressing the teen population. That's a different certification, and it speaks specifically to their needs and concerns. I have not done that, but it's available. That sounds fabulous. Training to staff, trauma-informed library services for staff and managers. Excellent. Can I ask, Andrea, can I ask if it's, is it a virtual program, or is it offered on a staff day, or how does, like, what's the structure of offering that to staff? A mental health program every month, touching on different topics. Is that, Heather, is that an organization in your area? Trillium Health Resources? Is that, I don't know what that is.
Well, I have a follow-up question while we're waiting for those answers or questions. Do you have you received any feedback from the participants of the program as to whether they've been able to use their mental health training or how it's impacted their work?
That's a good question. The answer is no. Other than my colleagues who the handful two plus a friend who attended, I haven't really followed up with anyone in terms of a survey or anything along those lines. I probably should have thought of that, but I did not. So I'm going to make a note for next time to get that follow-up. I should add about the training that was emphasized in the course is that you are only invited or encouraged to become involved with people in ways that are appropriate and comfortable for you and in ways that make you feel safe. It is not required just because you've had the training that you approach everyone who looks distressed and insist on providing them help. We all know if we work with the public that there are situations that may not be safe for you. And so your safety is the most important piece. And then it's just like CPR for people who are in need of that service, just to tide them over until they can get to the professionals who can do the actual work of healing. You're not required to do that if it's not a place that you feel safe or comfortable.
And I should let everyone know that sorry, there was a setting on Zoom that didn't allow you to unmute yourself, but I have changed that setting. I did not realize that setting was enabled. So you should now be able to unmute yourselves. Sorry about that.
That's helpful. Andrea, I see you did type that you have a social worker on staff in the Human Services Department. That's interesting and probably helpful. Thank you for that. If you had the opportunity, would you all be interested in this training, do you think? Thank you. Yeah. Excellent. What barriers do you think you might face in offering it to staff or the public? None? That would be good. Yes. Heather, I agree with you. The timing, or the amount of time it would take, I think that's why we didn't have more staff able to attend. I think if we had paid them, they would have come. And if anyone has any magic solutions for getting people into programming, I would also be interested in hearing that. Funding from friends, Andrea, or foundation. Yeah. Jasmine, they tried it years before and had little interest, so no one wants to try it again. Yeah. Maybe, just a suggestion, Jasmine, maybe offering the statistics. You know, you can find a lot more numbers, and some people who aren't convinced by words are convinced by the hard and fast, or the statistics that we see, and particularly if the program that you offered was pre-pandemic, you know, you can make a case for how much has changed since 2020, and that the need is greater, maybe, as an approach. Maybe also trying it as a pilot, and to see if on a small scale it would work. The other thing that I did not include, but that was part of my grant proposal, was statistics on the impact of the pandemic on the mental health of people of color. And in our area, we have a very diverse population, a diverse of all kinds of color, and of income, and of country of origin. Just we're close to the university, so we have UNC Charlotte. So we have a lot of people with different needs and different experiences coming in, but there are certainly statistics that you can point out that people of color have suffered more in the pandemic. And so if you serve a large population of people in that demographic, you know, that would be more of an maybe more persuasive that the opportunity would be put to good use.
All right, well, I think that we're just at about time right now. So yeah, if there are no further questions, I'd like to thank Gina for this presentation. It was really interesting and great to see that work being done. So thank you, Gina, and thank you everyone for attending. I will put a link to our schedule in the chat so you can see the sessions that are offered next, and we'll see you all later.
Thank you so much. Thank you.